بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. We begin by praising Allah subhanahu wa ta'ala for this opportunity for us to continue in our lesson in the book of Umdatusaalik, and we pray that Allah make this lesson a reason where our sins are forgiven, our prayers are answered. May Allah open for us the doors of understanding and bless us and with tawfiq and hidayah, that we are able to practice what we have learned and convey it to others, so that Allah make us any amongst the reason of hidayah, and may Allah bless us with husnul khatimah and protect us from all difficulties, trials and tribulations in dunya and akhirah. Ameen Ya Rabbal Alameen. So in our last lesson in Umdatusaalik, or Reliance of the Traveler, we are speaking about the reason of the inability to use any water that makes tayammum permissible. So the author mentioned there are, number one, we have the reason of faqdul ma, a person who does not have water. So if a person who doesn't have water, he can do tayammum, and we mentioned the conditions when it is wajib for him to search for water, and so on and so forth. With regard to the second reason, he mentioned khawfu atash nafsihi, he has any water but he need to use it for drinking, or someone else who needs any water, or even animals who that needs the water. This is the second reason which we mentioned already. Yeah? So the first and the second we spoke about in our last lesson. So now we are at the third reason. So we will straight away go to the third. The author mentioned asalis, the third reason where we do tayammum. So he said maradun yukhafu ma'ahu talafa nafsin aw udwin. So the third reason, he said there is a sickness. There is a sickness that afflict a person where he is unable to use water. So if he is unable to use any water, then he has to do any tayammum. And one of the reasons, he said talaf nafs aw udwin. The doctor mentioned, for example, if you use any water, you might pass away. Yes, the situation. The situation is such that if a person use any water, it can lead to death. I think last week I gave the example of a sahabi. He has a cut at the scalp, and then they put a bandage on him, and then that night he had a wet dream. So in the morning he wanted to bathe the obligatory bath, but he was asking around, should I open the bandage? The cut was severe. So the rest he mentioned, we do not know any concession with regard to this, that you have to open it and bathe as per normal. So he did, and he passed away. So in this situation, we say that using any water in this situation can lead to death. So in this situation, he cannot use water. So he has to do tayammum. So this is the first situation where a person does the tayammum instead of using water. Number two, sometimes it doesn't lead to death, but it leads to the dysfunction of an organ. So for example, a person is afflicted with certain disease at the eyes, and the doctor say that you cannot wash your face, because if you do so, you might become blind. Na'udzubillah min dhalik. If you do so, you become blind. So now the situation, it doesn't lead to death, but it makes one of the organs dysfunction. Likewise, if you got into the hands, if the doctor say that if you wash your hand, you will be paralyzed, or your legs, then this person cannot use water. So this is the example of udwin, yani talaf nafsin or udwin. Talaf nafs meaning it leads to death. Talaf udu meaning it makes one of the organs dysfunction. Aw fawata manfaati udwin, or it leads to the dysfunction of a particular body part. Dysfunction of a particular any body part. So there is a difference any between what we mentioned any earlier any and this. See, sometimes in serious any cases, it leads any to the dysfunction any in totality any of a particular any body part. So this can happen, and it leads any to the cells any in that body part any dead. So the body part any cannot any function anymore. But sometimes any it lead any to certain any parts functional and certain parts any not functional. So in this any situation also it is a concession that the person any should not any use any water, because any it leads any to a certain any extent the dysfunction any of a certain any parts any of a body part. So either any we say any the whole any body part any becomes any dysfunction, or we say that part any of that body part any becomes any dysfunction. Aw hudusa maradin makhuf. Or the doctor any said, and for example, any if you use any water, you will be afflicted any by a serious any disease that can lead any to death, or that can lead any to serious any illnesses. Then any he does any tayammum. He doesn't any use any water. Aw ziyadata maradin. Yani if you use any water, the wound any will spread, and for example, the sickness any will spread. Like in cases anywhere a person has stitches. So the doctor say any if you use any water, the wound any will delay. So rather than any after 1 week any you can cure any from the wound, it will take any 1 month. Ziyadatan marad. And the wound any will spread, any for example. The sickness any will spread. And if you use any water, the sickness any will spread to other body parts. This is the meaning of ziyadatul marad. Afwan. The ta'khirul bu' is coming after this. Ziyadatul marad any meaning it spreads any to other body part. It spreads any to other body part, or it brings any about any diseases. More yani disease, more yani illness. Aw ta'khir al-bur'i. That's what I mentioned yani it makes earlier and I mentioned any about that it delays any the cure. So rather than 1 week it becomes any 1 month. So all these things any will make any a person refrain any from using any water and does any the tayammum. Aw shiddati alamin. And if you use any water, there is a lot of pain. It brings any a lot of pain that a person cannot bear. Aw shay'an fahishan fi udwin zahir. This is shay'an fahish. Shay'an fahish and it change in the skin color. And if, for example, a person and he has a wound here, the doctor say if you use any water, it will change your skin color any to black any in color. This is called shay'an. So in this any instance, even though any there is no pain, but he can still any do the tayammum because any it will change any the color any of the skin. Fi udwin zahir. So he said that udwin zahir. What is the meaning of udwin zahir? Udwin zahir any meaning the body parts any that are exposed, like our hands here. For men up to the any elbows up to here. And usually any when we go out, these are the parts any that these are the parts any that exposed. So for example, any if there is a wound any at the face here, and the doctor said that if you use any water, this part any of your face become black any in color. So do we tell him that you have to use any water? If he use any water, what happens? Yani this is any apart udwin zahir. Yani he goes out, people see. This is like a type any of aim, deformment. So that is why any it is excuse. And he can do any tayammum. But if the wound any is this part any this body part or his back, this is not any udwin zahir. Because even if the color any changes, it is any parts anywhere normally any people any do not any notice. وَيَعْتَمِدُ فِيهِ مَعْرِفَتَهُ أَوْ طَبِيبًا يُقْبَلُ فِيهِ خَبَرُهُ. So lastly, any the author any mentioned how does he know that there will be sicknesses, there will be delay, there will be increase any in pain. So the author any mentioned by his own any experience. By his own any experience. and this particular person, and he feels any pain, and he knows any this pain that he cannot bear, khalas, and he does any tayammum. And he himself and he know that if I use any water, then this and he will spread any to other body parts because he has any experience before with his body. So this is any point number one. Point number two, he consult any doctor that is trusted. So this particular doctor and he is a trustworthy any doctor. So the doctor say that if you use any water, it can lead any to death, or if you use any water, dysfunction any of your body part, that they will be paralyzed, and so on and so forth. So he can depend any on the doctor. So just take a look any at the reason any of tayammum. So let us go back any again, because this is important. In fiqh any we have this term any that is called al-maradul ladhi yubihu tayammum, yani the sickness that makes tayammum permissible. So if a person asks you what are the sicknesses any that makes any tayammum any permissible, these are all this here. Number one, talaf nafs, yani it brings any to death. Any sickness any that brings any to death. This will be discussed also in the chapter of fasting. Because in fasting also, our scholars any mention any about who can fast and who cannot fast. The same thing. You will find any they use any the term tayammum. They say that any form of sickness that makes tayammum any permissible, then it makes any breaking any of fast any permissible. Just like in the chapter of fasting, and if a doctor tells you that if you fast you will pass away, then you cannot fast. Tamam? If you fast any of your body parts any dysfunction, then you cannot fast. So you will find it is the same type any of sicknesses that is mentioned in the chapter any of tayammum. Until in our fuqaha, our scholars any came out any with a principle. The sicknesses that makes any tayammum permissible. So these are the one. So let us any count any again. Number one any is any sickness any that leads any to death. Number two any is the dysfunction any of a body part. Number three, the function, the what you call it, the function any of any a body part. What is any the difference any again? One any is severe any in the sense that the whole body part any dysfunction. The whole any body part any dysfunction. Just like any a person any, for example, any the hand, when we say any the hand any dysfunction any, it cannot any function. It cannot any function anymore. You cannot any carry, you cannot any move around any with it. The third one any is a bit any lighter. Maybe any you can carry, but it is difficult. So it is something any that does not any cause any dysfunction in totality, but it cause any a type any of in English any we use any the term paralyzed, and it cause any a certain level any of paralyzed any where a person any cannot fully use that particular any body part. So this is number three. Number four, if it cause a serious any illness, hudus any maradin makhuf. Number five, ziyadatu marad. It brings any the illness to other any body parts, or it bring any more illness. So this is number five. Number six, ta'khirul bur. It will make any the cure delay any in the cure. Then we have shiddatul alam, yani a person any have severe any pain. Then we have shayn fahish, any that changes any the skin, changes any the skin color. So how many altogether any any we have? We have one. Sometimes any the first and the second is considered to be one. We have 1, 2, 3, 4, 5, 6, 7, 8. So we have any 8 any situations, and these are what any we meant any in the principle al-maradul ladhi yubihu tayammum. Any the type any of sickness or illness that makes tayammum valid. So these are the 8. Now when we go on into the next part. So the next part, the author will speak about a situation where a person has an injury. So this part we have to pay a bit of attention. So now we have a situation. A person for example faced with an accident, and then there is injury. This part of the hand is cut. There is a cut. There is an injury. Right. So this is the situation. So when you have an injury, sometimes you put any bandage, sometimes you do not put bandage. It depends. Sometimes you put bandage, and if it is severe, usually there's a lot of blood, there will be bandage. Sometimes there is no bandage, it's just medication. So the author will begin by speaking about injury without any bandage, meaning there is just a cut, for example. If that is the case, then we have to ask the question, can he use water or cannot? Meaning, can he wash his hands with water, with wudu as per normal, or he is not able to? Not able to here meaning the doctor he says that you cannot use any water. If you use any water, there will be delay in your cure. So delay falls under the part of the concession. Or the doctor he says that if you use any water, the injury will spread to other body parts, or it can cause even dysfunction of certain cells or certain muscles. Then he cannot use any water, or he himself is unable to bear the pain. It's severe pain, shiddatul alam. There is a lot of pain. Even the doctor say you can use any water, but he himself when he cannot bear the pain. So do we say to him that no matter what you have to use any water? No, in this situation, if the pain is unbearable, then he can choose not to use water. What is the meaning not to use any water? So how does he take wudu? So when he comes to the point where he wants to wash his right hand, for example. So now I imagine there is a wound. There is a wound. So once the wound is dried up, I put some ointment or medication here. So I cannot, this is an instance, I cannot use water. If I can use water, then khalas, I use water. My wudu is valid, no problem. But what if the situation I cannot use any water? For whatever reason, any of the 8 reasons. I'm unable to use, I'm unable to use any water. So this is where the author is going to speak about. How do you take any ablution? So we have to pay attention. A lot of people ask this question, and in reality we have to study this properly so that we understand, because there are a lot of things that are related to this that we must know of. So the author begin by saying wa in khafa min jurhin wala satira alay. So we have to pay attention here. Now he is speaking about there is an injury, jurh wala satira alay, meaning there is no bandage. Tamam, exactly the example I gave earlier. There is a accident, there is an injury, and there is no bandage, only any medication. So this is exactly what the author is speaking about. The author is not speaking about bandage, because bandage coming after this. After this, he is speaking about bandage and casting. So he said, "Ghasala sahih bi aqsal mumkin, fala yatruku illa ma law ghasalahu ta'adda ila al-jurhi." So now how does he take any wudu? He says that he take wudu as per normal, and he wash the parts that he can wash. So now I have this wound here. So I wash all this part I wash, right? I wash. And then I wash the part that if the water reaches, it will not reach the wound. It doesn't mean I have to wash exactly at the border of the wound. Because if I wash exactly at the border of the wound, there is a high possibility that the water will reach the wound. So it doesn't serve the purpose. So the author says that you have to wash up to the part that you are certain that water will not reach the wound. So I hope it is I hope it is clear. So normally people who are in this situation, they will put like a plastic or something, cover the wound. Cover the wound, and then when they wash their hand, the water does not reach the wound. So I hope it is clear. So it doesn't mean exactly you have to wash the parts that is not covered by the wound. But what is enough is that you have to wash the parts that will not lead to the wound. Clear, inshallah. So he said, وَإِنْ خَافَ مِنْ جُرْهٍ وَلَا سَاتِرَ عَلَيْهِ غَسَلَ الصَّحِيحِ بِأَقْصَى الْمُمْكِنِ. As-sahih meaning he wash the parts that is not affected by the wound. فَلَا يُتْرَكُ إِلَّا مَا لَوْ غَسَلُ تَعَدَّ إِلَى الْجُرْهِ. So I hope this is clear. Yani he can wash all the way up to the part anywhere he is certain that the water will not reach the wound. Because if he gets too close, the water will reach the wound. It is not any wajib for him to do that. So let me demonstrate how we do it. So now imagine I have wound on my right arm. My right arm there is a wound, right? So I take wudu as per normal. I wash my face. As per normal. I begin by washing my face. And then when comes to washing of my hands. When comes to washing of my hands, either I do the tayammum first or I wash my hands first. Because now I have to do tayammum because I am not washing the part where there is wound. I'm not going to wash because I'm unable to. So I have two choices. Choice number one, after I wash my face, I do tayammum. I do tayammum. How do I do tayammum? Yani I do tayammum with dust by two taps. So I say nawaitu tayammum listibahati fardis salah, for example. So now imagine I have dust in front of me. I put the dust in front of me. So when I tap the dust, I make the intention. How do I make the intention? In Arabic, we say nawaitu tayammum listibahati fardis salah. If the prayer that I'm going to pray is the fard prayer. So I say nawaitu tayammum listibahati. Remember, yani the intention for tayammum is istibahatus salah. Nawaitu tayammum listibahati fardis salah. If it is a wajib prayer, I have to intend fardis salah. So the intention of tayammum is different from wudu. Yani if you translate into English, I make the intention of tayammum for the obligatory prayers. For the obligatory prayers. When do you make the intention? When you tap the dust. You make the intention. And then you wipe one time. The dust your whole face. All parts of your face. How many times? Only one time, and not three times. And then you do the second type. You do the second tap, and then you wipe your hand. You begin by the top all the way up. When you reach up to the elbows, you turn down and stop at the wrist. Likewise, for your left hand, up all the way to the elbows, turn, stop at the wrist, and then you do this. So we have one tap for the face, one tap for the hands. So when we tap for the hands, so we start with our left hand, right? The right hand to the left, and then we do the palms. So tayammum one tap for the face, one tap for the hands. So the intention just earlier we mentioned, nawaitu tayammum listibahati fardhi salah. If you are doing tayammum for the fard prayer, this is the intention you make. But if you do tayammum for the sunnah prayer, you only need to say nawaitu tayammum listibahati salah. Yani I make the intention of tayammum for the validity of prayers. So this covers only the sunnah prayers. But if you say nawaitu tayammum li-istibahati fardhi salah, I make the intention of tayammum for the validity of the obligatory prayers, then you can perform the obligatory prayers. So it depends on what is the intention that you make. So this is very, very important. Otherwise your tayammum will not be valid. Clear, inshallah. So now I have the wound here. So what do? I wash my face. Wash. Wudu. I wash my face. Nawaitu rafal hadath al-asrar lillahi ta'ala. Or nawaitu ada'a fard al-wudu. I wash my face 3 times as per normal. And then I wash my hands. Maybe I start with my left hand. And then I wash my right hand, but only the parts that is not covered by the wound. This is what the author mentioned, Ghasal Sahih. Meaning it is not covered by the wound. Then what do? In this case, I take a towel, I wipe my face. I wipe my hands. All I wipe. Why wipe? Because you do not want to do tayammum while your face is wet. It becomes something else later. So common sense, when we want to do our tayammum after washing, we wipe our face, wipe our hands, and then we wait for a while to dry. Then we do tayammum. 1 tap for the face, 1 tap for the hands. And inclusive of the wound. All this we mentioned later. Because if we can make sure that the dust touches the wound is wajib. That you have to wipe the wound. Although you cannot wash the wound. So do you do tayammum for the wound? So if you are able to do so, then it becomes compulsory that you make sure that the dust touches the wound. So after that, what do? You wipe your head. Now you go back into wudu again, because wudu there's sequence. You go back into wiping of your head and washing of your feet. So can you see? This is a combination of wudu and tayammum. So some of you might be asking, why must you make tayammum in this situation? You must make tayammum because water cannot reach the wound. So tayammum is to replace the part where water doesn't touch the wound. That is why it is compulsory that you do tayammum. Clear, inshallah. So now when we read in the text, the author is speaking about this now. So he said, وَيَتَيَمَّمُ لِجُرْهِ فِي الْوَجْهِ وَالْيَدَيْنِ فِي وَقْتِ جَوَازِ غَسْلِ الْعَلِيلِ. وَقْتِ جَوَازِ غَسْلِ الْعَلِيلِ. When is the time that you are able to do tayammum? So he said the time is when it's permissible for you to wash that part where the wound is at. A bit difficult, So let me give an example. The wound is where? On my right hand. So wudu, there is a sequence. I must wash my face, then my hands. Correct or not? So I cannot do tayammum before washing my face. Why? Because in terms of sequence, I have to wash my face. Since the wound is on my hand, not on my face, so I have to wash my face, then I do tayammum. Then I can do tayammum. And as what I mentioned, I have 2 choices. Whether I do tayammum first or I do tayammum after I wash my hands. Just now I gave the example of I'm doing tayammum after I wash my hands. It is a bit difficult, but it can be done. It's just that you need to dry your face and to dry your hands. But which is better? Better is that I do tayammum first, then I wash my hands. This is the best. So how do we do it? I wash my face. Now the tayammum is on my hand. The wound is on my right hand. I wash my face. Before I wash my hands, I do tayammum. Because now it is the time for me to wash my hands. Correct or not? So it's permissible for me to do tayammum. So I only have to wipe my face, to dry my face, and then I do tayammum. 1 tap for the face, 1 tap for the hands. So remember, tayammum, no matter what it is, in our madhab Imam Shafi'i, 1 tap for the face, 1 tap for the hand. There is no such thing, tayammum on the feet. No such thing. In whatever situation, when we speak about tayammum, tayammum any is one tap any for the face and one tap any for the hands. So in this situation, instead any of washing my hands, I do tayammum first. Is it possible? Yes, it's possible. Because now any is the time for me to wash any my hands. I have washed any my face. By following any the sequence, since any the wound any is on my hands, I wash any my face first. When the time comes any for me to wash any my hands, this is where the choice comes in. Whether I want to do tayammum first or I want to wash any my hands. But as what I mentioned, the better thing any is, the better choice any is that I do tayammum first. So I do tayammum one tap for the face, one tap any for the hands. After any I do my tayammum, then I wash any my hands. And I avoid the wound. And this is in a situation where I cannot wash the wound. That is why any I do tayammum. If I can wash the wound, then I don't need tayammum. There's no need any for me to do tayammum. Then any he mentioned, فَالْجُنُبُ يَتَيَمَّمُ مَتَشَاء. With regards any to a person who is junub, he has not bathed the obligatory bath, and then he has an injury. He has any injury. So same thing. Yani he has an injury yani on his right hand, and he wants to bathe the obligatory bath. He has two options: whether to bathe first and do tayammum, or tayammum first and then bathe. He can choose. But in wudu, you cannot choose. In wudu, you have to follow sequence. If your injury is on your hands, you must wash your face first. Then you can do tayammum. But obligatory bath, there is no sequence. There is no tertib. So you can choose whether you want to do tayammum first and bathe, or you want to bathe first and do tayammum. This is what the author is saying. So now, because he cannot wash the part anywhere there is injury, that is why he needs to do tayammum. وَالْمُحْدِثُ لَا يَنْتَقِلُ عَنْ عُضْوٍ حَتَّى يُكْمِلَهُ غَسْلًا وَتَيَمُّمًا مُقَدِّمًا مَا شَاءَ. With regards to the muhdis, yani a person who doesn't have wudu. So the author any mentioned that it is wajib for him any to follow tartib. So he cannot wash the body parts except that before it any he has completed. Just like in tartib, when we say that you cannot wipe any your head unless you have washed your face and washed any your hands. So if the injury any is on your hand, you cannot wipe any your, you cannot any do any tayammum unless any you have washed your face. That's what I mentioned any earlier. Once any you have washed any your face, then you are given the choice whether you want to do tayammum first or wash your hands, because the injury now is on your hands. So the option any comes after washing any of your face. But what if any the injury any is on your head? What happens? When do I do the tayammum? If the injury any is on my head, then I have to wash my face first. This with regards to wudu. Right or not? I have to wash my face. Then I have to wash my hands. Then I'm given the option whether I want to do tayammum first or wipe my head. But with regards to junub, he's given the option at the first instance. Because bathing the obligatory bath, there is no tertib. So he's giving a choice whether he wants any to do tayammum first or he wants any to bathe first. So this is where the author is making the comparison between a person who is in janaba and a person who does not have ablution, muhdis. So he says, وَالْمُحْدِثُ لَا يَنْتَقِلُ عَنْ عُضْوٍ حَتَّى يُكْمِلَهُ غُسْلًا وَتَيَمُّمًا مُقَدِّمًا مَا شَاءَ. So he cannot move on until he has completed his tayammum and washing. So just now if I say that the wound is on my hands, I cannot wipe my head. I cannot wipe my head unless I do two things. I have washed my hands and I have done tayammum for my hands. Clear, inshallah? So he is given the choice only when he reaches his hands after washing any of his face. Whether he wants to do tayammum first or he wants to wash his hands. I hope it is clear, inshallah. I would like to take in questions, but I think better at the end of the I believe they are new one. Okay. Later I will take in questions, huh? Then he mentioned فَإِنْ جُرِحَ عُضْوَاهُ فَتَيَمُّمَانِ. So the author he mentioned what happens any two body parts and there is injury on two body parts. What he meant here is two different body parts. Maybe you can write this now. Two different body parts. What is the meaning of two different body parts? An example will be I have injury here and injury on my face. So face and hands are two different body parts. But if I have injury on my right hand and left hand, this is considered to be one body part, not two. So if I have injury on two different body parts, one injury, I have injury on my face and injury on my hand. How many tayammum do I do? I do two tayammum. And how do I do two tayammum? And before I wash any my face, I do tayammum. Then I wash any my face. And I abstain from washing any my injury. Right or not? And then when I wash any my hands, I do tayammum again. Second tayammum. For my hands. Then I wash any the parts any that I can wash. Exclusive any of the injury. So this is what we meant by two tayammum. If there are three injury at three different body parts, face, hands, head. For example, the whole head for example, where he doesn't have any place to wipe his head. How many tayammum? Three tayammum. So one tayammum before he wash his face, one tayammum before he wash his hands, one tayammum before he wash his head. If there are four body parts, which is wajib for us to wash, four body parts that has injury, face, hands, head, and legs. How many tayammum? There are four tayammum, but with a condition that they are not covered completely with injury. If they are covered completely with injury, then there's only one tayammum. Like in the case of a person who is burnt by fire. The whole body burnt, whole body injury. In this situation, only one tayammum. But if there is part any of the body parts is injured, part of the body part is not injured, then he has to do tayammum. So if three body parts, three tayammum. Two body parts, two tayammum. One body part, one tayammum. And the meaning of body parts here, we are speaking about different body parts. But if I have an injury, as what I mentioned, if I have an injury on my right hand and on my left hand, how many tayammum do I do? One tayammum. Because right and left, this is considered to be one body part. This is the hands. This is considered to be one body part. So please take note. وَلَا يَجِبُ مَسْحُ الْجُرْحِ بِالْمَاءِ إِنْ لَمْ يَضُرَّهُ. It is not any compulsory that a person wipes his injury with water. Earlier we mentioned that now the situation is I cannot wash my injury. I cannot wash. I cannot wash my injury. If I cannot wash my injury and I do tayammum, is it compulsory that I wipe my injury with water? So the author says that it is not compulsory for you to wipe your injury with water. Even if it doesn't cause harm. It is not any compulsory because you have done your tayammum. You have done your tayammum on his behalf. وَإِنْ كَانَ الْجُرْحُ عَلَى عُضْوِ التَّيَمُّمِ وَجَبَ مَسْحُهُ بِالتُّرَابِ. If the injury is on the body parts of tayammum, what are the body parts of tayammum? Face and hands. This is the meaning of body parts of tayammum. So if the injury is on my hands here, this part of the tayammum, right? So how do I do tayammum? I one tap for the face, one tap for the hands. Is it compulsory that I wipe the injury with dust? The answer is yes. So this is the thing that we have to take note, because some people might overlook these things. So let me repeat again. It is compulsory that we wash that we wipe the injury with dust, if we are able to do so. If there is no harm, then it's wajib to wipe the injury with dust. Clear, inshallah? So it is not wajib to wipe the injury with water, but it is wajib to wipe the injury with the dust. Then he mentioned فَإِنِ احْتَاجَ لِعِصَابَةٍ أَوْ لُسُوقٍ أَوْ جَبِيرَةٍ wajaba wad'uha ala tuhrin. So now we will enter into the chapter of Jabira. So what is the meaning of Jabira? Jabira last time it is they take any wooden sticks and they put any on the body part, on the hands or on the legs, and then they put like a plaster so that the body part does not move. And this is usually when there is what? There is there are broken bones or cracks. Nowadays, doctors what do they use? They do not use wood anymore. They use plaster. They use what do they call it? I think they use something like a fiberglass. So this is the meaning of Jabira. So there is Jabira, there is bandage. These are two different things. Jabira, remember, Jabira, if when there is broken bones, then you use Jabira. We use when we speak about Jabira, we are speaking about broken body parts. So Jabira is strong. But then the author also mentioned Isaba wal Lusuk. Isaba is bandage. Like an injury, usually when an injury, you do not put casting, the cast, because there's no broken bones, right? So usually what do people put? People just put any cotton, then after that they put the bandage. So this is called any isaba. A piece of cloth that covers the bandage. Then we have any lusuk. Lusuk in our in this time we call the plaster. There is blood coming out from the skin, so we put a plaster. This is called lasiq or lusuk. So there is bandage, there is plaster, and then there is the casting. So now when the author mentioned three things. So he said that if on the body part either there is a bandage or there is a plaster or there is a casting. He said wajaba wad'uha ala tuhrin. La ilaha illallah. All this one, and you have to pay attention. 90% of people miss this out in terms of its application, if not everybody. So I will just take some time to explain properly. What the author is saying? The author is saying that if a person has an injury, and that any particular injury is at the body parts of wudu, like the face, the hands, the legs, and this person is going to apply bandage or plaster or casting, where he knows that once he apply this, he cannot take it out. Just like a person, na'udzubillah min zalik, met with a motorcycle accident. A person met with a motorcycle accident. Then what happened? This part of his hand broke. So the doctor apply casting, correct or not? The doctor apply casting. Before he put the casting, here the author is saying, wajaba wad'uha ala tuhrin. For those who have the book, underline this. And I would like you to repeat this because normally people forget or people do not know. So as students of knowledge, we have to be aware, especially in our mazhab al-Imam Shafi'i. This is the relied opinion in our madhab, that a person must place the bandage or the casting or the plaster while he is in a state of ablution. So here the author mentioned wajaba wad'uha, and it goes back to the jabira, and the plaster or the casting ala tuhrin. Ala tuhrin meaning in a state of ablution. So now I ask the question, how many people you know who apply casting or bandage or plaster before they put any the plaster, before they put any the bandage, they take ablution. So that is why earlier I mentioned maybe more than 90% do not do this. But is it wajib? Yes, it's wajib. So when we say any wajib, is there a sin for not doing? Yes, if you know it. If you have any knowledge, and it's our fuqaha mentioned that if a person is ignorant, he is excused in this part, because usually people do not know this. But if you study this, you know this, and you purposely and you did not do, then it is a sin. So now in a sense, and you know this, in future now, but we pray, may Allah give us afiyah. But if anything happens that you need to apply bandage, thing, then you have to make sure that you take the ablution. So how can we imagine this? For example, earlier I gave the example, I have an injury here, and the cut is big, so I have to apply plaster and bandage. No choice. Otherwise, when the cut is too big, any blood will come out, and it's going to be very difficult. It will cause infection, and all these things are the concession for me to take to do tayammum, right? So I before I put the bandage, before I put the plaster, I take ablution. I wash my face, I wash the body parts that I can wash, and then I put the bandage. This is what he meant. So he say wajaba wad'uha ala tuhrin. Ala tuhrin meaning in a state of ablution. Wala yasturu illa ma la budda minhu. And he can only apply the bandage only at the parts where the injury is at, and the parts where the bandage is in need, to make it firm. Meaning you cannot apply the bandage excessively until you close the body part that has no relation to the injury. So if your bandage is just here and you can apply a plaster like this, khalas, you cannot wrap all around your hands, because now you can wash those parts, but because of the bandage now you cannot wash, and you are not in need for that part to be covered. So all these things will come later, maybe next week, because of time. Why the author is mentioning all these things? There's a reason why he mentioned this. But because of time, I stop here. I would like to see the questions. What kind of questions is there? I believe there will be people. 457. Okay. What is the niyat to do tayammum for obligatory bath? The niyat to do tayammum for obligatory bath is the same intention. Same intention. Nawaitu tayammum listibahati fardhis salah. Nawaitu tayammum listibahati fardhis salah. This is the intention. I make the intention of tayammum. I make the intention of tayammum for the validity of the fard prayer. Clear? So the tayammum is the same type of intention, because at the end of the day we are doing tayammum to pray. We are doing tayammum to pray. With regard to obligatory bath, this is coming. Next week we speak about obligatory bath. How does a person do tayammum after obligatory bath? Does he need to do tayammum again when the next prayer comes? If he has bandage, all these things will come. What if I am in a hospital bed and I cannot find clean earth and dust? In this situation, usually we follow the opinion in the Hanafi madhab, where they say that any type of dust can be applied. So we can use our bed sheet, our pillows, then we do tayammum. That can be done. The next question, how do we wipe the injury with dust? Seems like it will make it worse, especially for open wounds. So the condition is that if it is possible that you wipe it with dust, then it becomes compulsory. But if it is not possible, meaning it will make the wound worse, then it is not compulsory to wipe it with with dust. So this is the condition. If it is possible that you wipe it any with dust, then any you have any to do so. Aywa. Can tayammum be done by tapping any on wall? This is in the Hanafi madhab. Yes. In the Hanafi madhab, they say can, but in the Shafi madhab, it's not valid. Shafi madhab, and we always speak any about dust that comes in from the soil. Is that all? Okay, inshallah. If there is no other questions, I will stop here. I hope it is clear, inshallah ta'ala. So like what I said, chapter of tayammum is a bit difficult. Huh? It requires patience, requires time, and it requires any revision and understanding. May Allah subhanahu wa ta'ala bless us with tawfiq. ربنا تقبل دعانا انك انت السميع العليم وتب علينا انك انت التواب الرحيم واختم بالصالحات اعمالنا واجرنا الله يكرم فضل سبحان ربك بالعزة عما يصفون وسلام على المرسلين الحمد لله رب العالمين تقبل الله منكم السلام عليكم ورحمة الله وبركاته